Morning, everyone. I hope everyone's having a good Sunday. Um, Sunny outside, a little bit chilly. We went to Whole Foods this morning. Whole Foods is allowing people age 60 and up to go there at 7 o'clock in the morning to be the first ones to access the foods and to, since we're considered a more vulnerable population, to, keep us out of contact with the rest of the population. So we took advantage of that this morning and stocked up on fresh fruits and fresh vegetables and other fresh foods. Uh, so hopefully we won't have to be making too many trips back. You know, try to keep that to a minimum so we can maintain social distancing. So, as I said, it's beautiful out today. Hope we'll take a walk later. Um, Keep that activity up. Uh, Today, I wanted to talk about digestive symptoms. I mentioned it yesterday. Wanted to talk about a study out of China that showed that. Good morning, Nancy. Study out of China that showed that people with digestive symptoms were more likely to suffer critical illness and to not be discharged from the hospital um, alive. So, this study looked at 204 patients who had digestive symptoms. And so, how do they define digestive symptoms? Symptoms were defined as, anorexia or decreased appetite. About 84% of people had that. Um, Diarrhea, about 29% of people had that. Vomiting, only about less than 1% had that. So vomiting is obviously a very uncommon presentation. Um, Only about 3.5% of people only had digestive symptoms. The rest of the people had both the respiratory and the digestive symptoms, but they had worse outcomes. Why could that be? There could be a number of reasons why that is. When you have decreased appetite, you're probably taking in less food and fluids. So therefore, you can get a little bit dehydrated, and that probably could make people's outcomes worse. And the second reason is that most of the people who had digestive symptoms did not recognize that it was coronavirus. They were thinking more of the respiratory symptoms, so that they went to the hospital later. So seeking care later would make the um, your outcome worse. So both those reasons could make outcomes worse. So part of the reason I'm highlighting this is so that as coronavirus comes to our community, if you get digestive symptoms, don't presume that you do not have coronavirus. Now that's a double negative. So I guess what I'm trying to say is that if you have digestive symptoms such as diarrhea, decreased appetite that's going on, for a number of days, at least consider the fact that you could have coronavirus and seek some medical advice about that. If you have diarrhea for a day or two or decreased appetite for a day or two and that goes away, it's probably not coronavirus. Um, so, um, what can we do? Um, you know, I posted the article below, at least one of the versions of the article below, um, so you can read that. And then you can take measures to help your immune system, to help your gut, your GI tract, your microbiome. I believe that may decrease the effects of the coronavirus on your gut, on your immune system. Check out our Immune Support More group for tips and advice about how to make your immune system healthier. And join in there, join our community. Again, if people have questions, you can put them below. And I will answer them. I'll keep an eye on the questions for the next 30 minutes or so and try to answer them. Or I will, I can answer them in my next live, or, just post answers to questions that seem urgent. So I would say that, I will be on 8 o'clock tomorrow morning. If you want to hear the next update, there I'll be talking about tomorrow I'll be talking about why such severe, what seem to be severe restrictions right now, even though the virus, there isn't a lot of virus in the community. And I'll, update the latest numbers and how it looks like things are going. Okay, I will hopefully see you tomorrow morning. And, please, if you hear this, please take advantage to ask some questions. Okay. And if there's anything you want me to talk about, please ask that also. And I'll, get that into one of the morning sessions for sure. Okay. All right. Take care. Everybody have a good day, and I'll talk to you soon. Bye bye.